Okay, in the interest of time, we will get started here and let people join in as they do. But we are recording this call, so just so you're aware of that. I want to thank you all for joining for our Learning Network webinar today on building partnerships between maternal child health and housing. This webinar is presented by Dr. Keriann Uesugi and Adrienne Babbitt with MCHB. Dr. Uesugi is with MCHB and Adrienne Babbitt is with HUD in Nevada. I'd like to take a moment to introduce them both. So Dr. Uesugi is the health scientist for the Division of State and Community Health at MCHB. Dr. Uesugi is a maternal and child health epidemiologist who leads the reporting of the Title V and Maternal and Child Health Block Grant, National Outcome and Performance Measures, and supports technical assistance to the states around the performance measurement framework and use of evidence-based informed practices. Prior to joining MCHB, Dr. Uesugi was a research assistant professor at the University of Illinois at Chicago School of Public Health, where she led applied MCH epidemiology research and evaluation projects for state and federal programs. Her earlier work focused on global and domestic maternal and child nutrition research in academic and industry settings. She holds a PhD in human nutrition from Cornell University and an MPH in epidemiology and biostatistics from the University of Illinois at Chicago School of Public Health. Adrienne Babbitt joined the U.S. Department of Housing and HUD, or U.S. Department of Housing and Urban Development, or HUD, in September 2021, assuming the role of the Nevada Field Office Director. In early 2023, Babbitt became the HUD Charter Lead for Maternal and Infant Health. In this pivotal role, she spearheads an initiative focused on mitigating disparities in maternal mortality rates and addressing maternal health vulnerabilities within targeted communities. Adrienne Babbitt's journey into community service started in 2010, taking on the role of supportive care case manager for homeless and at-risk families in Central New York. In 2014, Babbitt moved to Las Vegas and took a coordinating role overseeing a transitional housing program, providing essential service delivery and residential assistance to veterans enduring homelessness. Babbitt is an active member of the community and recognized by her peers for her efforts and advocacy for marginalized communities and housing first practices. Babbitt is a veteran of the United States Army and holds a Bachelor's of Arts degree in psychology from the University of Nevada, Las Vegas, and a Master's of Arts degree in forensic psychology from Agrassi, excuse my pronunciation, University. Outside of professional pursuits, Babbitt finds balance in her personal life as a dedicated wife and mother to 2 children. Again, we are recording this webinar. It will be posted to the City Match YouTube page following this event. And if you have questions, there will be time for that as well. So I will turn it over to Keriann.
Thank you, City Match, for having us today on the webinar. For those of you who weren't able to attend our symposium in September at the conference, my name is Keriann Uesugi, and I'm here with my colleague, Adrienne Babbitt from the Department of Housing and Urban Development, or HUD. Next slide, please. I will be quickly going through our Title V National Performance Measure on Housing Instability before Adrienne introduces you to HUD, its programs and opportunities to begin partnering with housing. Next slide. A quick refresher on Title V. We're the nation's oldest federal-state partnership. We've been giving grants to states since 1935 and a block grant since 1981. We have a large and broad mandate to improve the health and well-being of mothers and children, including children with special health care needs and their families. We have the dual role as a public health program and payer of last resort. Key roles for Title V include being a funder, a leader, a partner, the convener, as well as an MCH expert. We emphasize accountability through the annual reporting of national outcome and performance measures while providing flexibility for each state to respond to the particular needs of its MCH population. Next slide, please. We have a performance measure system to help guide our work. At the top, we have many national outcome measures that are the ultimate outcomes of health status, quality of life, morbidity, and mortality that we hope to improve. We have identified national performance measures that are associated with the national outcome measures and are considered to be directly modifiable by state Title V programs. To modify the national performance measures, states are asked to incorporate evidence-based or informed strategies into their state action plan and measure them using an evidence-based or informed strategy measure. On this slide, you can see this approach with housing instability as an example. So at the bottom, you would have strategies related to housing. These come from a couple of our actual state action plans that are in place now. Participating in Interagency Council on Homelessness, and implementing a housing pilot for pregnant women that includes wraparound social supports. These strategies, when implemented, are intended to improve the national performance measure and reduce the percentage of pregnant women who experience housing instability. And we hope that improvement in housing instability over time would lead to improvement or contribute to the improvement in our national outcome measures. Those that are associated with housing instability include severe maternal morbidity, infant mortality, and child flourishing. Next slide, please. We've updated the Title V Performance Measure Framework for the first time since 2015. The overall performance measure framework remains intact with the same three-tiered structure, including national outcome measures, national performance measures, and evidence-based or informed strategy measures. The national performance measures are now organized by their domain of action. That is, the mechanism by which they are intended to improve the national outcome measures. The domains are clinical health systems, health behaviors, and social determinants of health. New NPMs have been added to address emerging and or more upstream priorities as identified by states and other stakeholders. Here you can see they are organized by domain of action. Two measures are designated as the universal NPMs, and all states are required to address them to accelerate national progress. They are postpartum visit and the women and maternal domain, and medical home. You'll see that medical home will be addressed for both children with special healthcare needs domain and children overall. Lastly, you can see that the housing instability measure at the bottom in gray can be selected for three different priority population domains. Next slide. We have two housing instability measures. The first is related to pregnancy and is the percent of women with a recent live birth who experienced housing instability in the 12 months before a recent live birth. Housing instability for this measure is defined as women who reported being evicted, homeless, or lacking a regular place to sleep in the 12 months prior to delivering an infant. This comes from the Pregnancy Risk Assessment and Monitoring System, or PRAMS, and data for this measure will be available in 2025. The second measure is for children and is the percent of children ages 0 through 11 who experienced housing instability in the past year. And housing instability for this measure is defined as a child whose parents reported being behind on a housing payment in the past year, the child maybe having lived in 3 or more places in the past year, or the child had ever been homeless. This comes from our National Survey of Children's Health, or the NSCH. We currently have data available for this measure on www.childhealthdata.org. Next slide, please. This map shows the state level estimates for housing instability among children ages 0 through 11. You can see the variation across states. Colorado has the lowest prevalence at 10.5%, and its neighbor New Mexico has the highest at 28.5%. We will be providing this data every year through our federally available data, and it will be stratified by demographic variables such as race, ethnicity, income, urbanicity, special healthcare needs status, etc. Next slide. You will be able to find this data on our TVIS website or the Title V Information System website next year. If you're unfamiliar with TVIS, it is a great resource. It's a web-based system administered by HRSA's Maternal and Child Health Bureau. Part of it is the data entry system for the state Title V grantees to submit their annual financial program and performance data as part of their yearly application and annual report. The other part is the TVIS web report system, which is a public interface that allows public users to generate reports from Title V data that are submitted by the 59 state and jurisdictional MCH block grant programs. You can use this website to search national and state level data on key measures and indicators of maternal and child health in the United States. You can also view national and state Title V MCH block grant financial and program data. And lastly, you can acquire information on an individual state Title V MCH block grant program. Next slide. As I mentioned, you will be able to find the housing instability NPM on TVIS. The data will be available on the TVIS web reports in November 2025, but you will be able to download an Excel file with all the data on our federally available data resource documents page in April, and the link is in the slide. Of course, after talking about our data for the National Performance Measure, I would be remiss if I didn't mention that other data sources may also have rich information about housing at the local level, including local data that are being collected through the 2025 needs assessment, or from other data sources like your local fatality reviews, including FEMA's and child fatality reviews that many of you are involved with, as well as housing program data available through HUD. Next slide, please. I just want to leave you with a workflow of where state Title V programs are right now. They will be submitting the 2025 5-year needs assessment in July 2025. At that time, they will select their 7 to 10 priority needs, as well as 5 or more national performance measures, plus any desired state performance measures, and develop their 5-year state action plan. Then from 2026 to 2030, they will be reporting annually on their progress for this 5-year cycle. Next slide. I know I didn't give you a lot, so if you have any questions, please do not hesitate to reach out. Here's my contact information. If I can't answer your question, I will certainly try to find the right person who can. And we can move on to our next presenter. Thank you very much.
Hi, good morning, everybody. Well, it's morning here in Las Vegas, sorry. Happy Friday, everyone. I'm Adrienne Babbitt, the Field Office Director here in Nevada, and one of the leads in the work that HUD has been doing within maternal health and housing, and appreciate the opportunity to talk about HUD's mission, programs, and partnership opportunities with you all. Next slide, please. HUD's mission is to create strong, sustainable, and inclusive communities and quality, affordable homes for all. The current strategic plan identifies several goals in how to achieve this work. Within the goal of advancing sustainable communities lives the action items to integrate healthcare and housing, because as we all know, housing is a social determinant of health. Next slide, please. So these statistics help understand who it is that receive HUD services. Many people often have a stereotypical idea of a HUD resident, but over half of HUD residents are elderly or disabled. And of adults aged 18 to 30 years old, over half of them are women. It is estimated there are around 50,000 babies born in HUD residents annually. Next slide, please. So we within the federal government love our acronyms and definitions. So I just wanted to level set what affordable housing is as we continue our discussion and provide some real world examples that might help everyone understand what we're talking about. Affordable housing is defined as paying no more than 30% of your income for housing or utilities. And that's on a spectrum. So if you have $1 million home and you're paying no more than 30% of your income on your mortgage, then you have affordable housing. AMI and FMR are terms that we use to talk about eligibility or guidelines for what's considered fair in the market. So AMI is area median income and determines eligibility for programs such as public housing or income-based housing, and also can discuss middle income or workforce housing. Fair market rents are located in each community or state. And if these slides are going to be available, there are links on here that will bring you to the HUD site where you can look up your specific community where you live to find out what your area median income is or fair market rents. This is an example from Seattle in King County, where the City Match Conference was held. And in King County, for this particular zip code, you need $120,000 annually to afford an efficiency. You need over $200,000 to afford a mortgage or 4-bedroom rental home in King County. And the starting salary for a special ed teacher is advertised at $62,000 annually right now. So just giving some examples for what we're talking about. Next slide, please. The National Low Income Housing Coalition is also an excellent resource for identifying what the inventory is in your state and what the needs are. So this is an example from Nevada, where I'm from, which I'm sorry to say has the least amount of affordable housing inventory nationally, with only 14 available units for every 100 low-income renters. This chart, the circle chart on the left, also shows that 35% of those renters are in the workforce. And the second largest piece of the pie there is for seniors. Next slide, please. So how did we get here? There are several contributing factors, but some common sense ones include the rising cost of construction with lower developer appetites, wages not increasing at the same pace as your property or rent has, land and zoning issues, and real estate investors taking inventory out of the market. I'm not sure about you all, but I'm still receiving mailers about investment companies offering to purchase my home. Next slide, please. So HUD has a lot of various program offices that operate different funding sources and programs, but I listed the ones here that I thought were most valuable for partnerships. But each program office, again, has several different things. So there's public and Indian housing, lead hazard control and healthy homes, multifamily, community planning and development, Native American programs, FHEO, and then the Office of Housing Counseling. Next slide. So if that doesn't mean anything to you, what you can take away from that is public housing, home modifications, income-based homes for senior, disabled, and families, homeless services, tribal housing and home ownership, discrimination claims and investigations, and then homeownership counseling. Next slide, please. So people usually have the most questions for me on how they access housing. And so I just wanted to give a little overview on the eligibility language for individuals experiencing homelessness and how it might differ from the definitions that Keriann mentioned around housing instability. Certainly no one will leave this room being an expert, but I just want to make sure that there is some awareness that they are different. So each community has a continuum of care, sometimes referred to as COC, that operates their homeless service response. And this system is specifically designed for those that are unsheltered, place not meant for human habitation, fleeing domestic violence, or in emergency shelter. And just a note here that the fleeing domestic violence definition has also been updated to those that have not yet fled. On the right, where we're talking about housing instability, it is the COC homeless response system is not designed for anybody that's couch surfing or staying with family, even if it's overcrowded. Those that are staying in hotel motels, having really hard time paying their rent, or poor housing quality, even if it's not been defined as place not meant for human habitation. There is some middle ground that some COCs might have programs for that can serve what's called imminent risk. And that's for those that might be facing eviction without resources to be able to pay for alternate housing, because we know not all eviction results in homelessness. Those that are leaving jail or incarceration, transitional housing, or being discharged from hospitals. So it really depends on local community programs and what services are available and what documentation they might need in order to access those services. Next slide, please. So here are some other housing programs that you do not need to be homeless in order to access. And these are things like income eligible housing, like I talked about, multifamily just based on your income, housing counseling, accessing home repairs for anybody that might be in unsafe housing, providing reverse mortgage assistance or first-time homeownership. And we know that just because we are the Department of Housing does not mean that we are the only game in town as it relates to housing. So on the right, these are all the non-HUD housing programs. And I'm sure this list is not exhaustive, but we have the low-income housing tax credit, naturally occurring or private housing, rural development through Department of Agriculture has some multifamily housing. The VA has a lot of really great housing programs through their SSVF program, which is rapid rehousing or grant and per diems. Habitat for Humanity is an example of a nonprofit, and some other grants that are provided through HHS, such as the Maternity Group Housing Grant or Housing Instability. Next slide, please. So working in housing instability space may be uncomfortable for someone who does not have much experience in housing. There's just so much information. And some of you may recognize this as the MCH Accelerator that offers evidence-based strategies for working within housing instability space. The next slide will show you that all the things HUD is currently doing within these evidence-based strategies that you could tap into some expertise there. So I think that's the end of the Housing 101 slide, and we'll move into talking about partnerships. But this slide shows how to access your local housing partners. So your HUD field office will be able to direct you with anybody that you might be interested in connecting with. You can search directly for your local continuum of care, find your local public housing authority, or identify where you're housing counseling. Yes. Well, so there was a question about putting the field offices in the chat, and I can certainly make sure we do that. So moving forward to talk about partnerships, if we can go to the next slide, please. Just some examples on how HUD and maternal child health can work together. And on the next slide, I will go over the charter work that I've been involved with called MOTHER, which is another acronym for Maternal Outcomes Through Housing Environments Reimagined. And we have been working in 6 targeted communities: St. Louis, Birmingham, Tulsa, East Harlem, Jackson, Mississippi, and Houston, Texas. There were some technical assistance dollars that were able to provide some really flexible funding to local organizations to develop some community-specific work plans. Home Base, I think if you go to the next slide, conducted paid listening sessions to local moms and dads to talk about their experiences and needs in the community. And some of the common themes that emerged are listed here. Probably no surprise to anyone on this call that there was a need for improved communication and outreach, person-centered care, addressing broader social determinants of health like housing, resource and capacity building, and having a stronger support system. Next slide, please. So one of the sites that we're highlighting today is in Birmingham, Alabama. The Campus of Hope is the public housing authority and has developed some really strong partnerships with a variety of local community organizations to take a holistic approach. Next slide. Yep, keep going. Next slide, please. Thank you. So the intake completed for new residents really covers such a broad range of topics, and they look at the person as a whole that works to link them with those services and community partners to help them achieve their goals and ultimately achieve self-sustainability. Once the need is identified, they are linked to services that are either provided locally at the PHA or close within the community. And then on an annual basis, these assessments are completed again and looked at whether there's new services or linkages that need to be made. So on the next slide, there are some examples of some of their community rooms and classes that they're holding for employment, education, financial literacy, character development, youth development, and health services. Next slide, please. So these are a list of just some of their community engagement partners that they're working with. And I'll point out Healthy Start on the list has been a really great partner there. The next spotlight is in Portland, Oregon, a public housing authority called Home Forward. And these are 3 future affordable housing developments that are in the works that are focused on family and early childhood learning centers or Head Start programs are already committed and linked to these projects, which is really great. The next slide also shows that they have several existing partnerships that are pretty cool. The Parent Relief Nursery has a vehicle that drives through the New Columbia housing development and allows parents to drop off their children so that they can self-care, attend treatment, employment, trainings, whatever other activities that parents need to do, and know that their kids are going to be okay. There was also a resident that was living there that identified a local doula training program that they wanted to take. And the certification course is now actually offered at the PHA and allows HUD residents to take those classes and get those hours in becoming a local doula. At Humboldt Gardens there is an MOU with the local Head Start where they're leasing space within the PHA. And in return, they're holding some spots for HUD residents to be able to access those services. And the Black Parent Initiative locally regularly performs home visits and engages new parents with any support that they might need. Let's see what's on the next slide. Yes, so their community builder program also pays their HUD residents a monthly fee to engage within their own community and look at what new partnerships could help the community be strong. These community ambassadors are really involved and invested in making their community great. Next slide, please. So I just wanted to highlight some future partnership opportunities that you might want to consider as you are looking at partnerships within housing or healthcare. I know that 5-year needs assessments for Title V are currently in the works. And if you are looking for partnerships or feedback or folks to attend listening sessions or whatever your needs assessment is looking like, HUD can certainly help connect you, educate those, the importance of it, to amplify whatever meetings are happening so that it is a true community effort to look at what the needs really are. We're also looking at partnering with anyone for vaccine clinics, mom support groups. If you are looking to display education or resource materials within HUD family housing, having community baby showers, developmental screening, or certification programs. I think there's a lot of opportunity to connect community services with HUD residents. Next slide. Oh, okay, so that was the last slide. We got through it a little quicker than I thought, but hopefully there is another presenter and we can have some questions and discussion on anything that you're anxious for more information about. Thank you.
Thank you so much, Adrienne. It's so great to have you back to present on this again. We're going to have our partners at AMCHIP present a couple things, but I don't think they're on quite yet. So if there's any questions among the participants, we can go ahead and ask them. And I went ahead and posted the field office link from that one slide, as well as the HUD Exchange website, where you can look up the contact information for HUD grantees.
We welcome you to come off mute if you're comfortable to ask questions, or you can put them in the chat, whichever you prefer.
Good morning, good afternoon. My name is Jill Miller. I'm from Alameda County Public Health Department. And Adrienne, you presented slides around housing instability by state. Is it possible to find out where to get that breakdown by county?
I think you're talking about my slide. The National
yes.
Center of Health doesn't have county level estimates, unfortunately, just the state level.
Okay.
I will say that as far as HUD data is concerned, every January, we conduct a point in time count that looks at the number of individuals experiencing homelessness at the community level. And that's typically broke down within your local continuum of care. So you could certainly find that type of community level data. Those that are experiencing housing instability specifically as it's defined by HRSA might be a little more difficult. You might have to look at those that like number of evictions that have been filed, or those that are seeking rapid rehousing services in the community might be a little more difficult to track that.
And then the subpopulations like moms with, or families with children under 5, those kind of breakdowns, is that found somewhere?
That are so, well, I don't know if it's specific for under 5. I know that HUD tracks number of families with children, whether it's specific age groups for children. I'm not sure how that data is broken down at the community level, but
Thank you.
certainly household type is.
Thank you.
Thanks for the question.
This is Julia from Illinois. To that same end, is the data on what you were talking about with area median income and the fair market rate, is that available at a lower geographic level, either census tract or county or something? Because that would be an interesting way to think about housing instability as well.
Yeah, absolutely. And I can drop that in the chat. The fair market rents are broken down by county and also by state. So you can look at, I believe the new fair market rents for 2025 have just recently been finalized. So you can take a look at that and then also compare them with previous years if you choose. Public housing authorities sometimes also do what's called small area fair market rents, which means that the zip code that you live in really defines what the rent is for that particular zip code. And that's done so that HUD vouchers can be more competitive with some areas that might see drastic increases in rent just because of the zip code.
Yep. And is the area median income also available through HUD?
Yes, it is.
Yeah, that'd be great. If you could drop those resources into the chat,
Yeah.
that would be very useful. Oh, Keriann, you're muted.
Thanks, Julia. I'll let Adrienne drop those links while we have our partners in AMCHIP share a couple of items of interest.
Linda Kasawati. I'm the Associate Director for Evidence and Implementation at AMCHIP. So thank you so much for letting us pop on and share a little bit more about some of the activities that we are doing to support Title V within the housing justice space. Next slide, please. So one of the things that we've been working on with some of the folks who are here on this call, but several months ago, we started, coming together with other partners at the national and federal level to better understand how we could collaborate around technical assistance and support and activities for folks such as yourselves to really address housing needs, and particularly for Title V within the context of the new national performance measure related to housing. So we've been working with HRSA, HUD, the MCH Evidence Center, City Match as well. to get some of this work started. And so we've been having a lot of really fantastic conversations. And some of the things that came out of that was this need to create spaces for folks to come together and share what they're doing related to housing justice, so that they could learn from one another, and then glean some additional tools and resources that might be able to support them in that space. So with that, one thing that I wanted to share with you all is that we have an upcoming workshop series. It is our MCH Housing Champion Forum. It's a two-part workshop. You're welcome to come to one or both sessions. They will build off of each other to a certain extent. But the first workshop is really going to be focused on sharing what we have identified as some potential roles for folks to play within the housing justice space. And you'll have an opportunity to hear from some states on how they have worked to address some of this work, especially leading on the partnerships piece, what they've done to create and foster these partnerships to address this work. So should be really good, very interactive. And then the second one will focus on, what can you actually do to implement this particular role? What would that look like in practice? How do you know that you're on the right track? And again, we'll have some states feature some examples of the work that they're doing in that space. So I'm going to drop the links to both of those workshops in the chat for you all. But again, we welcome you all to register and to attend. The first one is next week, so I know it's a little short, but the next one, you have almost a full month heads up for that one. But again, we really welcome you to participate in that, to hear from others, and to also share your insights. And with that, I will turn it over to Anna to talk about an upcoming project that AMCHIP is leading.
Oh, thanks, Linda. And on the next slide, we have a little bit of information about this. My name is Ana Corona Romero, and I am a senior specialist for child and adolescent health systems building. And I'm really excited to be co-directing this new project that AMCHIP was awarded for from our friends at the Maternal and Child Health Bureau. And it's called the Maternal and Child Health Policy Innovation Program. And the goal of this program is to support capacity building among Title V programs in terms of initiating policies around social determinants of health. And for our project, our specific focus is around food sufficiency and housing instability related policy for MCH populations. And so we are going to host 2 learning collaboratives. They're going to be 15 months each, and we're going to select 3 Title V led teams to join the first learning collaborative, which is going to kick off in April of next year. So we haven't quite started recruiting yet, but that will happen in February. And so part of what comes out, part of the support that the 3 teams are gonna receive as a part of the learning collaborative is essentially, it is Title V led, so we're asking Title V folks to apply to join the initiative. And once they join the initiative, we'll provide support in identifying a policy initiative that makes most sense based on the context of the state, and then support folks to build cross-sector collaborative teams around this effort. The other exciting thing about this work is that we've built a beautiful cross-sector subject matter expert council that represents various levels of policy expertise from national to community level and everything in between, and folks that have different topical expertise across social determinants of health. And we've developed that council specifically to provide wraparound support to our learning collaboratives. So participants in our collaboratives are able to say, hey, I need specific support with XYZ, and then we have this beautiful council of experts that we can mobilize to support each team's individual needs. So let me know if you're interested in being on the list for initial outreach on recruitment. I'll drop my email in the chat. We don't have any formal materials ready yet for recruitment, but be on the lookout for those early next year.
Thank you so much, AMCHIP, for Linda and Anna for sharing some exciting work that's going on in this housing area with states and hopefully with our local partners, our city match members. That's why we're here today. We want everybody working in the same direction on this topic. There was one, Adrienne, if you're still here, there was a really great question in the chat. I might have missed it. How do we sign up for HUD funding opportunities, especially as it pertains to maternal and child health?
Yeah, so I don't know that there's specific funding identified only for maternal and child health, but it's important to know that there's significant population represented that are in HUD affordable housing developments and public housing properties that are women and families. It becomes a little tricky because familial status is a fair housing protected class. And so saying that, this is only for pregnant women or children sometimes gets into some murky discrimination ground. But local communities can choose to give preference points for families with young children or pregnant or postpartum women within the eligibility, local eligibility and tenant selection plans. So I hope that's helpful.
It doesn't look like we have any other questions in the chat. Is there anyone who would like to come off mute and ask a question at all? If not, I did just drop a link into the chat for an evaluation of today's webinar. It's very quick, very short, but I do want to thank our presenters once more for taking the time out of their day to share this information with us and willing to be contacted by everyone who was on the call today. Just so you know, again, this presentation, will be uploaded to our YouTube channel. Yes, the recording will be available online. If you go onto YouTube and search City Match, it'll be up there in a few hours, probably shorter. But yeah, if there's no lasting questions, then I will give everyone a little bit of time back in their day. I'm sure there'll be a lot of follow-up between everyone. So
Thank you.
all right, thank you both. That was great, and look forward to all the work being done with AMCHIP as well.
Happy Friday.
Happy Friday.